I'm a physician and I trained first in primary care, and then I was really struck in primary care how the environment seemed to be really important for people's health, but we didn't always really pick up on it and things. So I decided to go back and do another training fellowship in what's called occupational environmental medicine. And that's the field of medicine where you look at anything in the environment that can make you sick, whether it's chemicals or physical factors like noise or infections in workplaces and the environment. And as I did that, I noticed that a lot of my colleagues were setting up animal labs and things where they would expose animals to all sorts of toxic things and figure out if it's bad for you or not by looking at what happened to the rodent or the rabbit or something in the lab. And I decided I was much more interested in kind of looking at animals in the environment, out in the wild, out in the environment where they're really exposed much more to sort of relevant things, and we could learn a lot by looking at sort of changes in wildlife populations and companion animals and food animals as sort of natural epidemiological studies rather than putting everything in the lab. So that was just my interest was learning more about the environment, partly by learning how the environment affects animals. And I started setting up a database of all the studies of animals that human health people probably weren't aware of, that were animals kind of out in the wild, and what was happening for particular chemicals and infections, and something called the Canary database we set up when I was at Yale. And then as I stayed on faculty and things, all these infectious diseases started coming out of animals. And so I became really interested about what's changing in the environment that's making these pandemic and epidemics like SARS and West Nile and bird flu and everything come out of animals. So I took a sabbatical and spent a year overseas at WHO and FAO and worked with a environmental health veterinarian, Lisa Conti, who in the past was really involved with, she was a veterinarian who specialized in environmental health. And we wrote a textbook together called Human Animal Medicine to look at all the things that doctors should know about animals and their clinical issues, but also how they relate to the environment, and what people should know, and what human health should know about veterinary medicine, and veterinary should know about human medicine, and how we both should understand how the environment plays a role there. And we sort of made it a clinical textbook. And I got kind of hooked on that whole idea of really bringing together the One Health perspective. And so came out to Seattle about 7 years ago to start a Center for One Health in a human health institution, because I felt like the One Health concept was so important that it should be in some human health institutions, not only in a vet school. And in Seattle, we don't have a vet school at University of Washington, but we do have our partner university, Washington State University. And so we've been really looking for ways to bring the two together on joint projects. And I think we thought about, I was actually talking to people at Davis and had recommended that they do something like start the Knights Landing one, which they did. And then in Seattle, we were seeing people on the street who were homeless and they had animals, and knew that like medical students were doing clinics for homeless people. And it seemed like a great way to bring students together to try to get a clinic like this going. So I started, one reason that I got started interested in talking about it was that it would be a way to engage health sciences students and see the world of veterinary medicine and how it was relevant to them as well, to kind of work together on that. And so I started talking to the dean of the Washington State University Vet School, the College of Vet Medicine, and he thought it was a great idea too. So we really started working on it a bit from a sort of an educational service project point of view. But the way we started looking at the issue was to do storytelling, actually. And we had a photographer, one of our staff members is a National Geographic photographer who's really into, what does she call it? Story journalism?
Photo documentary.
Photo documentary journalism. So she did like a year's project of actually going out and visiting the homeless people, actually camping out in the homeless encampments with them and taking pictures about the relationship of the people and their animals. And that helped sort of launch a sort of a more formal anthropological project that Vicky helped steer about doing kind of formative interviews. But we did this whole photo voice project. So we'll also send you, if you haven't seen it, a link to the photographer's visual storytelling website, which is really beautiful.
That's
It's
awesome.
called Everything to Me. So we really started from sort of a storytelling point of view, which is really neat to hear you. And then we started talking to some human health partners because we really needed a clinic in the community to work with, and we found Neighbor Care Health. And right at the same time, Katie was being hired because they needed a vet who was willing to bring in the vet work. And it just sort of came together that they were open to having us work in a youth shelter in Seattle, where they already had a clinic, but they know that people had animals and that we could set up a regular human animal clinic in there. And right from the beginning, we really wanted to make it integrated care where the veterinary people and the medical people were really working side by side. And we thought we'd have to do something with like infection control where the animals would have to be outside in a van or something where we wouldn't have it all together. But the homeless shelter said, no, bring them all in. We'll put them right next to each other. And so we've been physically co-located within 15 feet of each other in just adjoining spaces. And the whole idea is to look for obviously good care for the animal and the people. Sometimes people will come there wanting care more for their animal, but they then can get sort of encouraged to get care for themselves as well, because they don't always prioritize themselves, they prioritize their animals. And it's such a healing space that they get comfortable and do that. But that we want to look for a couple of key connections between humans, animals, and the environment. And one of them is because they face such challenging environments as homeless, we want to know, is there any evidence of environmental problem showing up in either the animal or the human that would be a signal that they both are dealing with stuff like a fungal rash because it's too damp in the tent, or fleas because there's an animal and people in close proximity, or sometimes there's like chemicals from the outhouse nearby and the animal's getting symptoms even though the person isn't yet, but it means that there's bad chemicals. So this whole idea of like the canary in the coal mine, and the animals can be the canary for the people, or the people can be the canary for the animals, but it's sort of back, and we want to share that information. And we also want to share information about zoonotic disease possibilities. So if there's, for instance, fleas, the person might be exposed to something like cat scratch disease, or if the animal has diarrhea, it could expose the person to gastroenteritis and disease kind of thing. So we want to make sure we're dealing with that kind of zoonotic potential. And then the third thing that we really want to look for connections is everything related to the human-animal bond, which we find has a lot of different overlaps with mental health, the reason they have the animals, the benefits and the barriers of having the animal. It makes it hard to get medical care or housing, but the benefits are so huge that they do it. And so we want to talk a little bit about our exploration of sort of those things, but we absolutely are trying to integrate care and look at the human health and the animal health and what both are saying about the environmental stressors that are affecting them both.